Metformin is a medication commonly used to treat type 2 diabetes. While it can help some individuals lose weight, it is important to note that it is not a weight loss medication and should only be used as prescribed by a healthcare professional. If you have been prescribed metformin and are looking to lose weight, there are some lifestyle changes you can make to help promote weight loss. Eat a healthy, balanced diet. Focus on eating whole, nutrient-dense foods such as fruits, vegetables, lean proteins, and whole grains. Avoid processed and high-calorie foods. Exercise regularly. Aim for at least 150 minutes of moderate-intensity exercise per week, such as brisk walking, cycling, or swimming. Stay hydrated. Drinking plenty of water can help you feel full and avoid overeating. Get enough sleep. Lack of sleep can lead to overeating and weight gain, so aim for 7 to 8 hours of sleep per night. Manage stress. Chronic stress can also contribute to weight gain, so find ways to manage stress such as meditation, yoga, or deep breathing exercises. It is important to work with your healthcare provider to develop a comprehensive plan for managing your weight while taking metformin. They can help monitor your progress and make adjustments to your treatment plan as needed.